What we are going to discuss is about the forgetting wound. So let us go directly to the presentation. How many of the participants have seen any such wound? You can put in the chat box if you have seen. Okay, so some of you might have seen such wounds, right? And of course, it is very much difficult to manage this type of wounds. Right. So, what is forgetting wound? I hope everyone can see the presentation as well as hear my voice.
Yes, ma'am.
Okay, thank you. So, what is forgetting wound and what is the cause and what we can do for it? Okay, how to prevent certain unavoidable circumstances, and if at all these problems occur, what to do. Okay, so that's what we are going to learn through this presentation, so that we all can make patients' life little better. So, fungating wound is a mass of malignant cells that have infiltrated into the epithelium. And of course, the surrounding blood and lymph vessels also. And that is why it creates many problems in the patient. So, it is seen as a complication of cancer, and it is said that it will develop in patients with advanced disease. And around 5 to 15% of patients with cancer are prone to develop these wounds. So, why they are caused? It occurs because of direct infiltration, as it is said above. Okay. It will invade the mucosal layer, blood and lymph vessels. Then it can also occur because of any distant metastatic deposit. Okay, so that is also possible. And of course, in the case of where the skin tumor is in the, the tumor is in the skin itself. Okay, so when there is primary skin tumor, they also tend to develop this type of ulcer. Okay, so why it is so important? You can imagine a person with this kind of wound on his or her body. Okay? So it becomes very traumatic because it is constant reminder, right? Patient will be able to see the wound on the body, and he will see it that constantly day by day it will worsen. The condition of it will go on worsening. Okay, so it is constant reminder of not only that the disease is progressing, but patient is moving to death. Okay, so that is constant reminder. So along with the physical problems, it creates a lot of psychological problems, social problems, and of course, spiritual problems. We have learned how to do the assessment of any problem under these four headings. Okay, so today also we will do it under these four headings at later point of time. And if this type of wound is left without treatment, then it has potential to extend and cause massive damage to the site and also surrounding tissues. Okay, so that is why it is very much essential that when we find this type of wound, we immediately take certain measures so that the patient remains little comfortable. Okay, so what are the characteristics and where it is found? It can be found in any part of the body, but mostly it is seen in the case of head and neck cancer, and of course in the soft tissue sarcoma, then in the kidney cancer, bladder, lung, ovary, vagina, colon, penis, breast cancers also. Okay, and there will be so many symptoms or along with the wound, including pain. Okay, there will be a lot of exudates, secretions coming out of it. And if it has invaded the blood vessels, there can be from minor to major episodes of bleeding will also take place. Okay, and with the increased number of the bacteria, aerobic as well as anaerobic, it will cause lot of malodor also. So these are some of the major problems. Now, what is the process of development? Okay, so when the fungating lesion takes place, the cells will proliferate very rapidly, and it will give rise to cauliflower appearance, as we just saw in the previous slides. The ulceration, it will cause open crater like lesion with the margins, and in the middle it will be having soft mass or say fluids oozing out. Okay? And it will also erode the sinuses at the local place. So what happens? Why the symptoms? Okay? So vascular deficiency will lead to the blood flow. Okay? And because the cells will have poor perfusion of the blood, it will create hypoxic regions, and it will cause the tissues to get necrosed. Okay? There also will be absence of or abnormal lymphatic vessels because of the cancer. Okay, we know that cancer cells are prone to create such vessels itself also and cause problems in whatever vessels are already there in the region. Okay, so there will be increased interstitial fluid, okay, and that will cause extravascular pressure. Okay, that will cause, the pressure will increase. So it will cause collapse of the blood pressure, okay, because the outside pressure is more. So there will be collapse of blood vessels. And it will cause, because the fluids is much in the outside the cells, it will cause exudation. Okay, so that will be causing lots of secretions coming out of the wound. Now, when there is excessive cell proliferation, it will cause the problem of the tissues will be having acidic pH of the extracellular fluid. Okay, and that will cause interference with the clotting mechanism. Okay, and because of that, what will happen? The tissues will bleed. Okay, and the tissues will be very fragile to touch. So when we do dressing, when we are trying to remove dressing, or we try to clean the wound, at that time, these vessels will bleed. So it can be minor bleed to major bleeds also. Okay. Now the tissues, the necrosis and the fluids, okay, because of that the tissues will remain moist. Okay, so it is moist necrosis, okay, and it will attract secondary infection also. Okay, both the kinds of bacteria you will be seeing, anaerobic and aerobic, okay, and it will cause further decomposition, and there will be volatile fatty acids, and that will cause malodor or and the exudate also. Right? So major 4 problems will be there. right? So malodor, exudates, bleeding, and later it can attract the flies also. Okay, so worm infestation will also take place. So these are major problems when the patient is having fungating wound. So how to manage this type of wound? What happens is that many a times the people who are not in hygienic condition, or they are not getting expert care, they land up into major problems. Okay, so it is very essential for us as the palliative health workers to take care of it, and so that the patient is kept a maximum comfort level. Yeah. So in such kind of wounds, healing will not be the objective of the wound care, because the wound may not uh, heal at all. Okay, so what we are trying to do is to keep the patient away for the prevention of the complications, major complications. We have to uh, take the steps. Okay, so symptom control only will be our primary goal. So holistic assessment of the patient and the wound is essential. And management should be guided by the problems identified by patient himself. Okay? Patient should be able to tell you what is happening to him. And of course, you can take help from the relatives also. Okay, and of course we are going to do assessment of the wound. Okay, so we can add on expert advices and care. So these are the points to be kept in mind. That wound is chronic in nature. It will be a very complex wound. Okay, so many times management becomes also complicated. Okay, and it will demand a plan that is individualized. Okay, no two patients will be same. So as we have learned in our nursing and whenever we are giving care, that any one problem should be looked into from the patient point of view. We always ask patient that because of this problem, what is happening to him? Okay, so no two patients will be same, and treatment plan will also differ in that sense. Okay, and it will include lot of psychological and social support from patient and relatives also. So why assessment on regular basis is needed? Right? What is the importance of assessment? It will of course help to plan the next step of the care. Okay? It will also help that in finding or evaluating that what care we are giving. So we can what next step can be implemented. Okay? And of course, it will provide better quality of life. Okay, so holistic approach should be always taken into account whenever we are giving care to a patient. Okay. Right. So here we would take 2-3 minutes to find out the problems under 4 headings, okay, using holistic approach. Right, so you can make list of physical problems, psychological problems, social problems, and spiritual problems of the people. You can see the pictures here, right? One old lady is having a wound on her left cheek. Okay, and another person is having a wound on the limb. Okay, so can you make list fast, and you can share the problems which the patient can suffer with in the chat box. Then we will discuss further. Let us take 2 to 3 minutes. Right. In physical, we have problem of difficulty in food intake. Okay, severe pain too. Looks, yes, pain, yeah. Isolation, right? Good. Yes, yes. Lot of problems are coming. Psychological, social, yes, physical. Good. Yes, fine. So, fine. So, you have listed quite a few problems in all under all the headings, all four headings. Good. So, physical problems, you as you said, the location, right? It is on the cheek, so it is obvious, very much obvious, and of course, the size of wound also will matter, right? What are the type of tissues that are involved in the wound? Okay, so we need to see that. Okay, what is the exudate level? Okay, what type of exudate is coming out of the wound? Right? What is the amount of order that is it is emaciated? Right? Then pain level, okay, including during dressing, right? There can be because of the oozing that the surrounding skin, right? Perioral skin will also be very soggy, so there may be a lot of pruritus in that region, right? Then it can also have maceration of that skin can also take place, right? Injured skin because pH is now acidic, right? So that may be causing a lot of other problems, right? Daily activities will be affected if the wound is on the say here the lady had wound on the cheek, right? So naturally the nutritional levels will be affected. Hmm. Daily activities, so simple, which we take it as very much granted, right? Like cleaning of mouth care, right? So that will be difficult. Then how often to change the dressing, right? Because of the large amount of the secretions from the wound, right? Whether the dressing material which we are applying, it may be quite bulky, right? So whether it is comfortable for the patient or not, how it will look, right? So and of course the infection level. So almost all you also had included, plus there are some new here indicated, and patient can have plenty more. Okay, these are just to name a few major problems I have tried to include. Right? What about the psychological issues? Right? Can you imagine yourself in such condition? Very difficult, right? So generally it is said that have empathy, right? Put your feet into the patient's shoes to identify the problems, or to, you can say, to feel the problems, right? So as you said, correctly said someone that it is on the cheek or any body part which is tend to remain open, right? So body image will be a major issue. And plus, even if the person, say opposite person, is not able to see the wound, but the mal odor that is coming out of the wound, immediately we can come to know. Even you are right at the doorstep, the patient may be in the inside room, but from the smell, you will find out that there is some problem in this house, right? So that itself, and you can imagine the condition of the patient and the relatives who have to stay in this situation 24 into 7. Right? So patient will feel like that he or she is rotting away day by day. It will be increasing, and there will be constant reminder, changing appearance, feeling of disgust, difficulty in communication, cosmetic effect of the dressing, bulky dressing will be there over the cheeks, say for example, in this lady. Isolation will always be there. There will be rejection also, many a times from the family members itself and the society, right? They will not be allowed to stay in the society. Many houses, many family relations are broken because of this condition. A patient may go into denial stage, patient can go into depression, there will be a rejection, feeling of defeat, right? They are not able to cope up with the disease, right? Embarrassment will be there, fear will be there, guilt will be there. So it is very difficult to identify and assess thoroughly in, such patients, right? And to explain them. Many times we find words less to explain the agony of these kind of patients. So we need to talk to them, the family, and maximum visits and the care that the patient doesn't suffer too much. What about the social condition? Right? Impact on the spouse, other family members, patients is not able to eat, relatives are not able to uh, digest the situation. There can be small kids also in the house. They may not be going near the near person. Okay. Self-respect is lost, sexuality is lost. Very less things are talked about in our country in this matter, right? Sources are getting over, support is becoming less and less, and because the person is totally dependent on the caretaker, uh, caretaker also may find it very difficult and lose the job, right? That can also happen. So economical condition will deteriorate day by day. And so a lot of problems will be there. What about their spiritual needs? Right? They might take it as punishment from God. Right? Society also might think that there is a curse on this family. That is why the person is finding this problem. He has landed up into this problem. Okay, so there can be rejection. Okay, anger, patient will have anger. Why this has occurred to me? What bad I have done to people. Right? Uh, Opposite thing can also happen, that they will go to places in search of the uh, cure, right? Where and they may become more and more despair because there is no result of this type of wound. So they may lose the very purpose in life itself. So many problems. Right? Now our management will encircle around these things. Right? So we can remember how to manage the exudate, how to manage the odor, how to prevent maggots into the wound, other infection taking place into the wound, prevention of it, of course, management of the pain and bleeding. Right. So this is one thing we need to remember. So Hope's model is very nice. We can remember under different headings, okay, and identify the problem, the severity of it, and do the needful for the person. Okay, now first point we will discuss about the management of the wound. Okay, so what to do about the wound? So palliative use of radiation and chemotherapy, debriding of these tissues, okay, can be possible. Then surgery if the local infection is less, and if the condition permits, then the flap surgery and all can be possible. For that, we need to see the general condition of the patient also. Right? So aim will be towards the control of infection with the help of systemic antibiotics along with our regular dressing. Okay, so for that, we need to see to it that patient remains pain-free. Right? What kind of pain can be there? Right? You must have learned regarding pain issue. Right? So patient can explain or can describe the pain as aching, stabbing, or it can be continuous pain also. So depending on the type of pain, we can give the analgesic drug as per the WHO ladder, and plus adjuvant drugs can be used. Right? So dose can be adjusted. Right? Now, what time should be there for the dressing? So as we discussed in the previous session also, that always give an analgesic before 30 minutes of the dressing. Okay? Or you can do that you plan the dressing time after the regular dose of the analgesic what he is getting. So in both ways, you have to plan the time of your dressing. And it may happen that patient requires more than one dressing a day. Okay, so that will depend on how much the secretions are there, right? So depending on that, we have to do. If the patient is having superficial pain, like burning and stinging type of pain, then local analgesic like lignocaine jelly can be used. Even opioid soap can also be used 10 minutes before dressing. And many times you can mix the, because for order we are using the matrogel powder. Okay, so this matrogel tablet powder can be mixed with the lignocaine jelly, and that can be applied over the wound. For incidental pain that occurs only on movement, ketamine sublingually can be given. Okay, of course, we need to then see the other vital signs also. So, why malodor is there? That is caused because of the anaerobic bacterial growth in the dead tissues. We just saw the pathophysiology. So, daily bath is very much essential before dressing. Always ask the patient to take good bath. Okay, so that will help in removing the not only the adhered dressing, but it will also help in removal of the dead tissues, and any slough is there that can also be removed. Okay, so that can be done. Then we have to clean the wound with the help of isotonic saline. Okay, and then we sprinkle crushed tablets of metronidazole over the wound. Many times we can irrigate the wound with the help of liquid metrogel. That's what we get in the bottles. So with that also we can irrigate the wound. Okay, so if needed, systemic metronidazole can also be given. But many a times it can cause nausea, vomiting, right? So we need to see these side effects also in these type of patients. Dressing, many times it is preferred twice a day. Okay, and of course it will depend on the oozing amount. For infection, use of systemic and topical antimicrobials can also be used. Okay, but this Metrogel gives good result in controlling the malodor. Other things like use of charcoal can also be done. Charcoal dressings are also available. Of course, they are costly and availability is also sometimes becoming difficult. Then for the odor in the room, what we can do is that use the charcoal, keep the charcoal pieces under the bed of the patient. So that will help. Air freshener can also be used. Okay? And kapoor can also be used. Incense sticks can also be used. Right? So we need to control the odor because it will affect on patients' diet plan also, and on the it will have bad effects on the relatives also. And so we need to see into that. Plus, when there is a bad odor, you can place pieces of the newspaper under patient's bed sheet. Okay, so the carbon in the ink of newspaper will also absorb bad odor. So that also can be used. Use of camphor is also there, to control that odor. Another thing is the exudates. So what to do, right? So we also just saw that we need to do more frequent dressing. Right? So how much sogginess is there in the dressing? So depending on that, we need to change the dressing. And here the dressing material that is used is based on the gel technology. Okay, so that maximum amount of absorption will be there. Okay. So moderate or large quantity of exudate is found in this type of wounds because of the increased permeability of vessels within the tumor, and of course because of the action of the bacterial enzymes. Okay. So related problems will be there like soiling, peri-wound maceration of the tissues, leakage from the dressing, okay, and odor. So these things need to be managed effectively. So films we can use, alginates are used, hydrofibers are used. Okay. So the diaper technology is very well used here. Even the sanitary pads are cut into pieces and kept over the wound. So you have to cut according to the shape of the wound, okay, and then use it. So it also has good absorbent power. So maximum amount of exudate will be absorbed by this material. And of course, we need to identify whether there is any infection in the wound. Right? So depending on that, antibiotics are also used, maybe locally or maybe systemically. Many places, local regions, they also use honey, silver, or iodine containing liquids, so that also is good for the this type of wound dressing. Okay, so surrounding skin also need to be taken care. We need to use barrier film products that are useful, okay, because the skin will become very fragile and can get damaged and the condition can deteriorate further. So minimize the skin contact with the exudate, that should be safe. Many times palliative radiotherapy may be beneficial to reduce the exudate. So that also we have to look into the condition. And of course, we have to tell about the see about the benefits, right? Whether patient is able to take these therapies or not, because the general condition, how good it is for the patient. So that needs to be assessed. These are some of the materials which are used in the cases of the fungating wounds, like foam, and other side we can see what are the benefits of it and what to consider. Calcium alginates are also used. Honey, you can see here in the list, right? It has very high osmolarity and low water activity. So bactericidal effect is also there. Okay, it will also keep the moisture there. Yeah, and it will help in removing the necrotic tissue. So it promotes healing also. Silver containing liquid or the ointment is also used in many cases. Charcoal use, I just told you, right, that it will absorb small gas molecules. Ready-made charcoal dressings are available, so that can be used. Baking solution is also good, so that will help in removal of the necrotic tissue, and plus it will also remove the bad odor. Okay, so dipping the part in the baking solution and then doing dressing also helps. And metronidazole is very widely used. What we have to advise them is that keep the metrogel tablet powder nicely crushed and in the airtight container they have to preserve. So whenever you need, as per the need of the wound, we have to apply. In case any bleeding occurs, then what to do? Right? So when there is the tumor has infiltrated the blood vessels, many times this problem will occur. And when we are changing the dressing, when we are doing the dressing at that time also, we are trying to clean the wound at that time also, bleeding can take place. So if it is in small minute amount, then you have to press it locally for 10 minutes and then do the remaining dressing. Okay, so for the treatment of infection is very much essential. Sucralfate powder is available so that you can sprinkle locally. So it will form coating and then it will help in treating the bleeding. Systemic use of ethamsulate and tranexamic acid is also done. Many times adrenaline packs can also be used for the bleeding, but of course it should be used with caution because it has tendency to cause elevation of the blood pressure. Okay, so it can cause further bleeding. So we need to find out how good it is for particular individual. So sterilization at home, we need to teach to patient, right? How to sterilize the dressing material and how to make normal saline. And I'm sure you must have seen these points under many of the conditions, right? When you are making normal saline, use 1 pinch of salt in 1 glass of water and boil it for 20 to 30 minutes. Or take 2 teaspoons of salt in 1 liter of water and then again boil the water and store it in clean bottle. So that is very essential and it should get used in 24 hours. For this type of wound, when we require large amount of dressing material, it is very difficult for the patient to go for the commercial dressing material, right? Because it becomes quite expensive for them. So what we need to advise is that all the used clothes, they can wash thoroughly and dry under the sun. Okay, cut into small pieces as per the size of the wound. Okay, and then sterilize them at home. Right? How to sterilize? They can use a mesh type of the surface, and below it they have to keep the boiling water. Okay, so in a vessel, put water, take water, see the stand is above the water level, so that when the water is boiling, at that time it won't make the dressing material wet. Okay, and then store these dressing materials in airtight container. Now we just saw that the patients will have bleeding also, right? So what to do? So always tell the relatives. We have to tell these points beforehand, so that patients and relatives are ready what to expect and what they are supposed to do in certain time of emergency. Okay, so they can use dark colored clothes, okay, to soak the or to absorb the bleeding. Okay, because otherwise both the patient and the relatives will get frightened looking at the amount of the blood coming out. Okay, so these things should be taught. Then how to dispose of the waste material. Okay, so that also will be required. So at the local level, you have to follow the waste disposable methods what we are doing, because when we are in different countries we have to see. Here we advise them to burn also, and if the medical facilities are available nearby, many a times they do help such patients to I mean they can discard the material in the they can be collected at the services that are provided by the hospital. So whatever is available in particular country, that should be followed, and regular follow-up by the healthcare team. Okay, that is very essential. So now the worst part of it, that is the maggots. Okay, now why the maggots crawl into the wound? That these problems, the oozing and the odor and all, will attract the house flies. Okay, and when they sit over the wound, they will lay eggs there, and out of that will come out the maggots. Okay, so that's what we want to prevent. Okay, so we have to advise them that they should always remain under the mosquito net. Okay, that is very, very essential. And the wound should be always covered nicely, first with the dressing and then with the cloth. Okay, so with the clothing, when they cover, less flies will be attracted. How to remove maggots. Okay, that is also essential. So what to do, that the dressing material you have to dip into the turpentine, right? And then keep it near the wound. Okay, keep it near the maggots where they are there. Okay, so it will cut off the oxygen supply and the maggots will come out. So with the help of the thumb forceps, you have to take them. Right? Side by side, you have to keep the one container also. In that also you have to keep the turpentine. Okay, so as you pick up the maggots, you have to place in that, right? So they will be clean. So and keep count of these maggots, okay? Because every time you do the dressing or every time the patient's relative do the dressing, we have to ask whether the maggots have decreased in number or not. So that is very essential. As the turpentine is very much uh, irritable to the skin, generally we don't pour it over the wound. That should be remembered. Okay? Then other things which are used locally are the mineral oil, then ether, chloroform, ethyl chloride, mercury chloride, creosote, saline solution, of course, we are using phenol, olive oil. Okay, so these things are very much used. There is another research paper also where they use systemic ivermectin, albendazole, and clindamycin. Okay, this is known as triple therapy also. So that is also quite useful for the use of for the maggots treatment. So that can be done. Yes. So always remember to tell the patient to sleep in the mosquito net. And later on, after cleaning the wound, pack the wound nicely. Okay, so day by day, it should reduce. Taking care of the psychological issues, right? So what to do here? Lot of counseling will be required for the patient and the relatives. And for that, we have to visit them quite often when the patient is at home. Right? So for the physical look point of view, the part should be always covered. Okay, wearing of dark clothes that will hide blood. Okay, drugs to reduce if required. We have to assess whether patient is having kind of depression signs and symptoms or anxiety, that we have to assess and give the if required drugs can also be useful. Social needs, counseling of family members is very much essential, right? So we can involve the social worker to identify the needs, can take help from the NGO. Economical support is also essential. So if the family has not got their ration card or BPL card or whatever economical help that is available from the government, so such things we can identify the needs of the family, how we can help them. Even we can take help of volunteers also, right? So they help them in gathering the necessary certificates, okay, so that they can apply from the government help. So various schemes what are available and what documents are required for them, that should be helped out by the with the help of social worker and volunteers. Spiritual needs, we can involve the spiritual leader also, right? And breaking barrier between the patient and close relatives is very much essential, so that they can finish off their remaining business. Whatever is their last wishes of the patient can be met. And so such things, we as health professionals, we have to talk with the patient and relatives. So with this take home message, I would like to end my presentation here. We can discuss the any questions if you need to ask. Lot of chat I can see. I have not gone through all.
Thank you, ma'am. If anyone have any questions, you can unmute yourself and talk, or either you could put it in the chat box also. Ma'am, there is a question in the chat box. How to give the patient clindamycin capsules?
Clindamycin capsules. I mean, they. If the patient is able to take orally, then they can take, or pints are also available. So IV it can be given. So in that way we can help.
Hello.
Yes.
Good afternoon, ma'am.
Uh,
Ma'am,
yes, Susan,
good-
please.
ma'am, I had a question. Like charcoal dressing, whether it is useful for fungating wounds or not, ma'am.
Yes.
How much it is
It's used.
useful?
Ready-made dressing, I think it is coming. I have not seen, it's not used in my center, but in webinars, I have heard that they use it over the room.
Okay. Thank you, ma'am. Thank you.
Like, I think in Pallium also, I have not seen charcoal dressing, right, madam?
Yes, ma'am.
Pallium also charcoal dressing, because basically the cost is the problem. So
Because, ma'am, when we study like marginal ulcer or fungating wound, like it is written in literature, like it is very useful for to reduce the odor as well as help in the
yes.
absorption of the exudates.
If don't use that as dressing, say for example, as dressing, economical, it is not, patient is not affording, right? But the simple charcoals which we use for the burning, so that we can use to keep below the patient's bed, not for the wound. Okay, but below the patient's bed we can keep, so that it will absorb all the bad odor from the environment. So in that way also we can reduce odor in the surroundings. So that is also good, because air fresheners and all, many times it will be very difficult. So other measures also we have to see.
I think Mr. Gabriel have a question. Sir, please.
Yes, yes. Are you getting me?
Yes, sir, please.
Yes, hello.
Yes, sir, we can hear you.
Yeah, are you hearing me?
Yes, sir, we can hear you. Please.
Okay, okay. I have just two concerns. One is the honey dressing in places where we don't have access to the honey. What can we use to it? Second, we don't have experience of doing a charcoal dressing in South Sudan. Just I need a little understanding on how can we do it and how can we apply it, because you don't get used to it over. Yeah, it's the only two thing that I want to clarify.
I'm sorry, but can't hear you clearly. If you can type your question in the chat box. Madam, can you hear it clearly?
No, ma'am, I cannot hear it. Mr. Gabriel, if you don't mind, could you please type it in the chat box? I think your bandwidth is low. You are not audible.
Okay.
Thank you.
Mm.
Do anyone else have a question? Sharina, do you have anything to ask?
How frequent we have to change the dressing? That what I want to ask. And the thing for a mega dressing, how to use the turpentine? It using with the dressing materials, right? Soak with the turpentine. The dressing material soak with the turpentine and keep it there.
See, how often we can use, how often to change the dressing, it will depend on the how much exudate is coming out, right? If the exudate is more and your dressing is becoming wet very fast, then you may have to change the dressing 2 times minimum. at in a day, right? Once in the morning, once in the evening. That is also there. And use how to use turpentine is we don't have to pour it over the wound. It is very irritating. So what we do is that you dip the gauze piece in the turpentine and then keep it near the wound wherever the maggots are, right? So it will cut off the oxygen supply to the maggots in the wound, okay, and then they will try to jump out of the wound. So when they are coming out of the wound, at that time you have to pick them up with the thumb forceps, right? But you should not fall many times. What because in they as soon as you try to pick them up, what they will try immediately to go inside the wound back, right? So your forceps should not follow them inside the wound, because otherwise you may injure the blood vessel and the fragile tissues in the wound, right? So not to follow with the your forceps into the wound, that we have to remember. Yeah, we need to have some patience because this type of dressing will take a lot more time, right? So because all the other problems also will be there. Patient may be having pain and all. That's why first try to control the pain of the patient, and then you take your time, right? Collect all the material, whatever is necessary in one place, so that you don't lose the time in that collection also. Right? And then start doing, because it requires a lot of time, whether you are doing at home or you are doing in your OPD or ward setting, in whatever setting.
We have a question.
Betadine solution it will irritate the tissues, right? So for cleaning and all, we don't use betadine. We just clean with the normal saline. That is the best thing. And then apply the matrogel powder over the dressing. If the patient is, because when you are cleaning, patient may have burning sensation. So you have to ask the patient what kind of pain is there. Okay, so many patients require this xylocaine jelly, lignocaine jelly, you can say. So in that we have to mix the matrogel powder and then place it over the dressing material and then apply over the wound, because many times the wounds are quite big. Okay, so you will require a lot of matrogel powder. So that's why I said that we have to keep the tablets crushed and keep in the airtight container. So when it is needed, when you are doing dressing, at that time you can take from that container box. No, we don't use hydrogen peroxide for dressing, because again, it is very, very irritating and you do more harm rather than good for the patient. Oral antibiotics for types of wounds, yes, we can use. If there is secondary infection, you can do it. Sometimes culture and sensitivity test is also done to identify what kind of microorganisms are there in the wound, and then accordingly treatment is given. But all these things will depend on patient's social, economical condition also. So accordingly, we need to give. So simple broad spectrum antibiotics can be used, which are not so costly.
I think there is no other question. There is another question in the chat from Mr. Jijo.
Yes, Dakin solution is basically hypochlorite, sodium hypochlorite, and plus one or two things other. So that helps in removing the slough, and it also helps in removing the bad odor. And when we are doing dressing, at that time, we need to see to it that it as the slough will get removed, you can see the freshly coming up granulation tissues, right? So that will help. Sugar is not used. Honey is used.
I think
because
there
it
is.
has good bactericidal effects, right? So that's why it is used.
Thank you, ma'am. I think we can move to the case presentation. Abhirami, ma'am.
Yes, ma'am.
I can share the screen for you.
Okay, ma'am.
Okay, ma'am, carry on.
Good afternoon, ma'am. Patient details. 87 years male with a diagnosis of left frontal hemorrhagic condition, hypertension, diabetic mellitus, and post-COVID positive. And the presenting complaints, patient had history of slip and fall, and he had a lacerated wound in his left posterior auricular region, drop in GCS level, E2, V2, M4, irrelevant speech present, and repetition of words present, weakness over right upper limb and lower limb, muscle power is 0.5. Next slide. The history of illnesses, patient got admitted in hospital on 18/1/2022 with history of slip and fall, followed by lacerated wound in auricular region. GCs were E2, V2, M4, altered speech and weakness were right upper limb and lower limb. CT brain taker report shown left frontal thin subdural hemorrhage, unknown case of diabetes mellitus for 25 years, hypertension for 10 years, and had COVID positive on 18/1/2022. And appropriate analgesics and anticonvulsants and other supportive medications were taken. Cardiologist and pulmonologist opinion was obtained, and his advice followed. And sudden drop in GCS level, and he developed breathing difficulty and desaturation. Saturation level is 60%. Patient was intubated and put on mechanical ventilator, and he had fever spikes for which he was started on antibiotic on empirically, and then a repeat CT brain was taken, which showed increase in edema with midline shift. Hence, anti-edema measure were stepped up. Next slide, no. On examination, the temperature was 98.2 degree Fahrenheit, respiratory rate 16 breaths per minute, and blood pressure 140/90, heart rate 82 beats per minute, and saturation 90% on room air, and cardiovascular system, and S1 and S2 sound are present, and respiratory system, non-vesicular blood sounds are normal, and abdomen was soft, and the blood glucose level is 150, and GCS level was E2, V2, M4. And treatment and significant investigation. CT brain, initially they done CT brain on 18/1/2022. The shows left frontal hemorrhagic condition, left frontal STH, subdural hemorrhage with edema and Moss effect. Appropriate analgesics and anticonvulsants, anti-edematic treatment given. COVID test done on 18/1/2022. Report were positive on 19th. Isolation as per COVID protocol, and pulmonologist and cardiologist opinion obtained. And sudden drop in GCS, and again they done CT brain. That report shown increased in edema and midline shift noted. Anti-edema drugs injection mannitol 200 ml, injection 3% normal saline at rate of 50 ml per hour started along with injection Lasix 40 mg as diuretic. Sudden desaturation and breathing difficulty noted. He was intubated and put on mechanical ventilator. And he had fever spike for which he was started on antibiotic empirically in view of poor weaning process, need for prolonged ventilator support, and inability to protect the airway. Tracheostomy was performed on 31st by ENT specialist. Electrolytes checked and managed appropriately. Physiotherapy and rehabilitative measures were started, and continued muscle power improved to 3/5. Tracheal sample stain culture and sensitive report shown growth of Acinetobacter, which was managed as per contact isolation precaution and appropriate antibiotic. Patient discharged from the hospital on 16/2/2022 with bypass support and rails tube feeding, Foley's catheter, and along with the IV antibiotics. And medications, tablet Levpil 500 mg BD and tablet Pan 40 mg OD given, tablet Dilsam 30 mg, tablet Lozar 50/5 mg, tablet Rosuvas 10 mg, injection Lantus 10 units after breakfast, tablet Jalra M 50/500 mg, neb Livolin 0.6 mg, neb Mucomix 200 mg given. And the psychological aspects, client is having anxiety due to clinical progression of disease and self-isolated due to tracheostomy. He is more dependent to his daily activities which causes stress and depression. He is more concerned about economical status of family. Hence, he is depending on his daughter and son. Family members were very depressed about and anxious about his critical condition of the client. Psychological support and family counseling with help of multidisciplinary team given. Next slide, ma'am. Main concern and skin care and positioning to prevent pressure ulcers, as he is bedridden for more than 2 months, to prevent deep vein thrombosis, active and passive exercise, limb physio, DVT prophylaxis, either by mechanical or by pharmacological. Nutritional support is formula feeding through rail strip feeding, proper suctioning to prevent airway obstruction, and chest physio, tracheostomy care to prevent infection, monitor vital signs, saturation, blood glucose level, pain assessment by using behavioral pain score. And summary, as client is known case of subdural hemorrhage, monitor vital signs and GCS pupils, monitor saturation level to assess airway patency, to provide chest and limb physio, to avoid respiratory distress and deep vein thrombosis. Nutritional support by rail strip formula feeding, tracheostomy care and suctioning, oral care to prevent pneumonia and other candid infection, catheter care to prevent urinary tract infection, eye care by using eye drops like Justrius and refresh drops to prevent corneal ulceration, back care and positioning to prevent pressure ulcer. Next slide. The discussion points is infection control and nutritional support and maintain airway, avoid pressure ulcer and fall prevention, family counseling. Thank you.
Thank you, Abhayami. There are many aspects in the case. I think we can discuss about this pressure, ulcer, and wound. Anna ma'am, can you read it?
Okay, I have jotted down certain points, and if is the patient at home only?
No, initially he's in hospital. Now he's in home, ma'am, with nursing support.
Okay, fine. So, in for the infection, mainly he's prone to infection because of his catheterization. Right? So we need to explain to his relatives how to do catheter care. So that is one thing. Keep the penile area clean and all that also need to be remembered. Then other thing is that the position of the urobag, the collecting bag, that always should be below the body level. That has to be told to the patient. Teach the relatives mainly, and whenever they are doing care at that time, washing hands of the relatives is also very, very essential, because small cuts here and there, and shortcuts, what I mean to say, that can create problems in patient when the patient is totally dependent on the relatives. Right? So that also has to be taught. And regular change of the catheter, that also when the team with the nursing team, when the he is doing rounds of home visits, so that should be seen. So when we are visiting, many times we find the patient is having uh, all the deposits in the the euro bag catheter and all that. So at that time, if we need of the bladder irrigation is there, that should be done. So when we are doing home visit rounds, always look out for any signs of infection whenever the patient is on catheter. So that is there. Then how to take care of the tracheostomy tube, that also needs to be explained. Right, so changing of the, again, the gauze space just under the skin and between the skin and the tracheostomy tube, right? That is essential. Change of the tie and all. So skin fold is there, so that is taken, that should be taken care of. Nutrition, he is on some formula, that's what is written, but is the patient's relatives affordable to or they at home they can, what type of nutrition material should be used, right? So generally what we advise is that take help of the local resources that are available, what all they can take, right? So that will depend on different regions. So we have to advise how to make the diet, the food for the patients, rice tube feeding if he's in on rice tube. So that is very essential. Then prevention of bed sore is of course very much essential. Last time also we had seen those points, so that can be followed. Prevention of fall is very, very important, as he is elderly also, and he also already had an episode of fall, right? So further fall should be avoided. So at home, say for example, his bed can be kept, one side of the bed should be covered with the wall, right? And the open side can be covered, the bed can have some side wooden block or like that, right? So that can be fixed with the bed, so that arrangement can be done, or keep the heavy chairs along with that bed on the open side, so fall can be prevented. Keep some alarm type, I mean, like what we have system of bell in the hospital. So if a small ringing of thing is there with him, then he can ring and call the relatives when he wants to get up. If at all he can sit up now. If he's not able to do that on his own, then there is no point of that. But many times when these such people are just left alone in one corner of a house, so they get agitated also, psychologically depressed also, socially they are totally cut off. So such needs should also be, I mean, we have to look into the thing. And when the patient is having anxiety and like that, so we can use distraction method. Then control breathing can also be used. Of course, all these things, it is very easy to say, I know. When the person is in home, it becomes quite difficult. So we all need to learn these things, because we all at one or the other point we get the person in our home house. So this is very, very essential, that whatever they like to listen to or they like to watch to, such distraction equipments like TV or radio or now mobile also, right? It has become quite easy. So such things should be used. That's from my side. One more thing for mal order, when we say that metrogel irrigation we use, like right, with the use of the liquid metrogel. So for breathing difficulties, we use nebulizer, right? So in nebulizer, instead of normal saline, we can place metrogel, and when the cavities are there, right, deep seated cavities are there because of the wound, we can use this nebulizer equipment for so that the small you can say vapor of the metrogel can reach the deep tissues also. So that one thing was remaining in to tell. That there was a good discussion. So I thank all. It was very nice to see so many questions, and all can benefit through this. So this good thing. Anything, any more questions?
Any other questions?
Albendazole is used. Yes, someone has written albendazole 1 dose is given. And if required, of course, it can be repeated also. So as per the doctor's advice, we can do. Presentation was quite nice. We got to know many other points also, right?
Madam, this metronidazole solution, how much nebulizer?
Nebulize directly 2 ml also you can use.
Need to dilute with saline.
Or you can dilute also, both the ways. 1 ml this thing, and 1 ml of normal saline also you can use.
If there is no-
Gargles, when we want to do gargles, so when the oral cavity problem is there, so when bad odor is coming from the oral cavity, at that time you have to advise in half a glass or 1 glass of water, they can add 5 to 6 drops of metronidazole, and with that they can gargle. So it will remove bad odor from mouth. So when there is problem in the mouth, they can use like that also.
Thank you so much, ma'am. Thank you all for being so much interactive, and it was a wonderful class. And thank you all once again. And I have shared the feedback link with you. Please do go through it and fill it up. And I have shared your assignments, assignment 2 and assignment 3. Assignment 1 is under valuation. It will be shared soon. So please go to the links and complete your assignments as soon as possible. Thank you all. We'll see you on the next class. Bye.
Thank you.